Hi everybody, I'm Dr. Shweta Bansal. I'm a pediatric oncologist practicing in Mumbai. So today we are going to talk about childhood cancer on the occasion of International Childhood Cancer Day. I understand the word childhood cancer is a scary word and no parent would like to hear this word. But the important thing is that now we know a lot about childhood cancer. It is curable, and the most important thing, it happens. And there are almost around 100 children are diagnosed with cancer in our country every day. So this is the incidence of childhood cancer. It can be anyone. So there is no prediction that who can have it and who will not have it. So if there is a information and there is a awareness, we can actually protect our child and give them the best treatment option. So this video is about the information, what we need to do if we are suspecting or if our child gets diagnosed with childhood cancer. So first of all, what is childhood cancer? Childhood cancer actually happens in small children. When we are talking about small children, it is up to the age of 18 years, and different types of cancer happens in different age groups. Like small children, they have more of a blood cancers. Adolescents, they have more of a bone cancers. And in between, there can be an overlap. So the commonest childhood cancers are bone cancers, blood cancers, brain tumors, lymphomas, and abdominal tumors, which includes Wilms tumor, neuroblastomas, and rhabdomyosarcoma. So these are the commonest tumors which happens in children, but there are many other multiple types. So whenever your child is sick, you don't have to think about any serious illness in them, but you have to be aware of the various things. First of all, any child who's having a fever which is not responding to antibiotics, and it is more than 10 days, I would say from more than 7 to 10 days, and child is losing his appetite, he's losing his weight, he's not taking interest in the surroundings, then definitely this is a sign of seriousness. If the child is having a bleeding from the gums, he's having a bluish spots on the body, he's developing red kind of a pinpoint rash on the body, then again this is a sign which we need to take care of. If the child starts complaining of backache, if the child is starting limping, he is having a body aches, again you need to think that there is something serious is going on in my child. Other signs and symptoms are if the child abdominal girth or abdomen starts increasing in size. You can feel that some hard mass or something is palpable in the abdomen, or the size of the abdomen is increasing, though the weight of the child is decreasing. And the child again is not taking interest in the surroundings. So these are the few signs which are very, very important, and we need to take care of it. You should always approach your pediatricians and thoroughly investigate. See, initial investigations, even if you overdo investigations, it is okay, because a major problem can be taken care of. And early diagnosis and better treatment can help and save the life's child. So whenever child is diagnosed with cancer, every parent, they come and ask me, why my child? What is wrong with my child, and what is wrong with our family, why my child is having a cancer? So there is no answer for that. Actually, it can happen to anybody. The genetic mutations can happen to anybody, and it can ultimately form a cancer. So there is nothing like there is somebody has done anything wrong and that's why the child is having this disease. There is nothing like that. The most important thing, how we can help the child. The first thing is the right place and the right doctor you have to reach, so that the things can be taken care of. And then proper investigations should be done. Unnecessary investigation should not be done, because we need to save the time and we need to investigate and start the treatment as early as possible in these children. When we talk about the investigations, there are few investigations through which we can easily know there is something wrong, which are simple investigations like blood test. That is a complete blood count we do. Sometimes we come to know from the renal and kidney function test or liver function test. We do LDH. These are the few basic blood tests. But if we feel something wrong is there, then we have to do more investigations, which include CT scan, MRI, sometimes PET CT scan we need to do, depending upon the disease. All these investigations are not necessary for all kinds of cancer. Some investigations are needed in few diagnoses and some other investigations are needed in other diagnoses. So your oncologist can best guide you and tell you which investigations are required. So the three main modalities of the treatment are chemotherapy, radiotherapy and surgery. So chemotherapy is the treatment which is given through mostly IV, that is intravenous through glucose, and the children, they tolerate this treatment very well. The immediate side effects which we see in these children is vomiting, sometimes loose motions, and there is a hair loss. But with now best and modern supportive care, these symptoms again can be minimized, and the children, mostly they come in the daycare nowadays, they take chemotherapy, go home, and many a times they are able to attend their school also, especially online schools. So treatment can be done without disrupting the life of the child as well as the parents to quite an extent nowadays. The other treatment like radiation, which is radiotherapy, this is not required for most of the childhood cancers because we want to prevent a child from the late side effects of the radiation. But in some of the cancers, it is an important modality, and depending upon the need and as per the protocol, sometimes we have to give. Again, there is no need to be afraid of any kind of a treatment. Most important thing is, like whenever a child is having a diagnosis of cancer, we want the child to live, and we need to save the child's life. And for that, some treatment needs to be given. And now with the modern medicine and proper protocol-based treatment, there are minimum side effects. Immediate side effects are negligible, and even the late side effects, which includes like having an effect on the lungs, kidney, heart, these can be minimized if a proper protocol-based treatment is given to these patients. So my request to all the parents is that never get confused, never get nervous. Most important is always contact your pediatrician, and they are the best people to guide you to the specialist who can help you in reaching a right person and the right place, and right care can be given to your child. So our motive is on this International Childhood Cancer Day is, through your hands we can save our precious little children. Thank you so much.